I would especially first thank our guests from abroad, friends from Turkey, friends from Nigeria, friends from China, friends from Egypt, and UK, yes, of course. We don't consider you from UK, so. And my friend, the Minister of Health in Punjab, and I think he will deserve it, perhaps, because I know him from some time. So it wasn't a surprise when I saw him today. Welcome. First of all, let me congratulate Nawaz, who is Ruhi Rawa of this, who is the man behind all this organization, and Professor Farooq, who is really an expert and perhaps one of the best endoscopic surgeons in Pakistan. I deliberately did not did it perhaps with it because I thought there should be something, because in social media what happens that now there might be some trolling going on. So forgive me if I didn't say the best. I really don't know. When you get the pressure of lifetime in knowledge, in skills, and in wisdom in Pakistan, just like we had our friends from abroad, I don't think we can call it any more luckier day or event than ever before we had in Pakistan. So it's great. Before this, we used to go abroad in order to conduct, for example, to attend these workshops. But now there are people like Farooq and Nawaz. I'm sorry I am speaking without doctor or without professor because they're more like my younger friends who have the enthusiasm to arrange such activities. It's not easy. It's not only not easy, it's not affordable. It needs a lot of cash, and it needs a lot of time, and it needs a lot of perseverance, and especially, and the special thing is, it needs a lot of push by the organization. So if all these things come together, when the will is there, the way comes out. And that's how the knowledge is transferred, that's how the technology is transferred, and that's how the wisdom comes, and that's how the uplift of society, and especially in this case, endoscopic surgery, will be improved in a way that it will be considered as one of the fundamental activity that really lifting the interest of the younger generation that is sitting all around. It's not easy to be a neurosurgeon, and it's not easy, and it's not even more difficult to be an endoscopic surgeon. Previously it was like microscopic surgery, but then in endoscopic surgery, I think there is more than what is involved in, say, microscopic surgery, because you need a support and you need some organization that has, say, cadavers or dead bodies on which you can actually practice. There is a long patience that is required to improve your skills and also to be able to be a safe, sound, and expert endoscopic surgeon. I especially feel proud because I'm now on the way out, or I already have been out. And old dogs, new tricks. There is a saying that it's very difficult when you go out an old dog to actually learn new tricks. But I'm very proud because just like any father or just like any senior, there are two things in your life that you really love. Your children or the next generation should be better than yourself. And today, some of my friends who are here, they have proved that they are better than me, and I feel proud that I did my job in a way. I'm not taking the credit for myself. I was myself the second generation of neurosurgery in Pakistan. We really give credit to Professor Zaman, Professor Bashir, and Professor Raja, who really were the founding fathers of neurosurgery in Pakistan. We call ourselves as a second generation of neurosurgery. When we came from abroad, there were a number of us, Tariq Salahuddin, Tariq Saab, Tariq Hashim, and there are a few others, Ahmed Ali Shah Saab from Karachi. That was a second generation of neurosurgeons. And the one that got trained with us, they became the third generation. And when you have grandchildren, they say, there is a saying in Urdu, कि सूद जो है वो आपने जो असल से ज़्यादा प्यारा लगता है. Means that the interest on your savings is much more dear to you than your own children. So the grandchildren are here. And Pakistan is proud of you. There must be something in your training that has really made you what you are, Dr. Farooq, Dr. Nawaz, Dr. Inayat, and there are so many other friends that are sitting here, young neurosurgeons who were young when they were with us. Now they also have gone bald and grey like me. इससे एक लतीफ़ा याद आया, पिछले दिनों सोशल मीडिया पे हमारे ग्रुप में शेयर हुआ था, खासकर नदीम साहब तो बिल्कुल ही मेरे वो लगते हैं, क्या नाम है, हम उम्र लगते हैं आजकल, उन्होंने दाढ़ी तो लंबी रख ली है तो इस वजह से. बात ये है कि जी what happened is the class fellows met in a bazaar or in a market, and one of them said, "Oh, how are you? You're okay." And he turned around. The class fellow turns around and said, "Baba, मैंने आपको पहचाना नहीं." So what happens that when you meet after a long time, what happens that you have changed to a more wiser, more wisdom, more experience, and I think there is no substitute for that. But one thing sure, that if you were a teacher or if you're a father, you make people walk, you make people learn. So they become self-learners and self-workers. And when they are self-learners, they are lifelong learners. So therefore, what happens is what we used to do in our time, like for example, one of my professors, Khadim Moeddin Saab, great surgeon in Peshawar. I actually am a graduate of Khaleeq Medical College. He used to make a big incision for cholecystectomy as compared to our other professor. And he was a very jolly teacher, fantastic surgeon. And he said that, for example, once I asked, because I used to take liberties with my teachers a bit more than perhaps usual, I said, "Sir, why do you make such big incisions?" They used to say, "Big surgeons." He had a style like this. Big surgeons, big incisions. Small surgeons, small incisions. Today it's just not. Big surgeons, small incisions, and small holes and keyholes. And probably I have got another thing to say, to share with you what I feel one day is possible. In the past, when you used to go through the airports, you used to have check all around, isn't it? You used to get undressed, or they used to check the pockets, this, that, and other. Now you go through the gate, and if there is no noise, you go past. Is that true? Yeah. All you have to do is take your belt off and this, that, and that. I think one day there is going to be a gate, and you'll pass through it, and what will happen? Any cell that has little change in its, say, blood-brain barrier, or any cell that is multiplying or not behaving properly, there will be some silent chit, 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 and they'll say, come on, let's check you further. And you will go through another gate, and they will say, all right, this cell is not behaving. So the third gate, you go through it, behave yourself. They will treat it. And therefore, there will be, just like the security checkup in the airports, there will be little gates on in the hospital, perhaps even 10 years from now, or even 20 years from now. So there is going to be an artificial intelligence that might take over all the real intelligence. There might be a development to an extent that before the disease is actually has started, or have a need to start, an intention to start, there might be a diagnostic then, and then you will manipulate the cell at a macro level, or at a mitochondrial level, or at a subcellular level, and the treatment will be there. And wrong. There are two kinds of ilms. Yes. What is the ilm al-abdan? It's a physical. It's a physical ilm that is about materials, about, say, anything that you can see, anything that you can touch, anything that you can smell, anything that you can actually do something with, which you can lay your hands on. But then there is another type of ilm which is called ilm al-adyan. That's Arabic saying. And ilm al-adyan is something philosophical. And that is what I don't think any gates or any generation can pick up unless you're a good human being. And that's where all the philosophers, or all the, what shall I say, the people who really guided us how to love other people, how to take care of ourselves and how to take care of others, how to be passionate, how to be truthful, how to be professional. For example, no matter how skillful I am, if I can't take the history properly, if I can't do proper physical examination, and if I can't really do an appropriate analysis in order to come to some conclusive diagnosis by doing appropriate investigations, no matter how good endoscopic surgeon or a microscopic surgeon or a robotic surgeon you are, I think the results would not be as good as you when you are a good human being. So the most important thing is the patient needs the good human or humane behavior. This touch is like a mother's touch, the parent's touch. And I feel that is something that perhaps we will keep on learning from each other by socializing, just like we not only listen to and operate on dead bodies, but the most important thing is that we have a human being and we have to have empathy. Empathy, professionalism, and corruption has no place in medical sciences. I think if you do it in order, for example, if you perform your normal activities with a passion that the patient should get better, even if I lose my, say, a party, that's where your priority has to be a patient. So the most important thing is compassion, and the passion to do well so that the patient must be satisfied is what is. It should not only be done, but it should also seem to be done. I always, they say about justice, that justice should not only be done, but it should seem to be done. Similarly, care should not only be provided, but it should seems like it's being provided. So no matter what technology does, love is something
and compassion is something, and your care, the real care, is something that comes from inside and by a human relationship. So along with humans, to go up, right up to the sky in technology, we have to be humane as well. And I feel for that, professionalism is something that is important. We may actually tick every step that we do, but this is something that we would learn when we handle and we go along. So we have to really get into the shoes of the patient. Let me tell you this, conferences like this gets all three in one. The management, for example, it's not easy to organize such a conference. The skillful people that come from with skills, knowledge, and wisdom, and the leadership that is supposed to be there so that the things should go in a proper way. And I'm sure that the organization, Akhter Saeed Hospital's management, and also such a beautiful place. To be honest, it's the first time that I'm visiting the hospital, but I had gone on Murray Expressway, and several times I had a look. It was very attractive. And I think the venue and the organization and everything that I heard about is excellent. I congratulate you all, especially Farooq, and I think a lot of probably, I think, clap for the management as well as for Nawaz. Now, last but not the least, I think I talked about first, second, third, and fourth generations, but I did not talk about the coming generation. You are the futures. Let me tell you, when I was young and I wanted to do neurosurgery, my mother-in-law told me that you want to become a neurosurgeon. She was the first gynecologist of the KPK of Khyber Pakhtunkhwa. And she told me that, look, every patient yours would die and you will die of hunger. Not every patient died, and I didn't die of hunger. So neurosurgery has come a long way since. Nobody used to take neurosurgery at that time. And they thought that I'm mad that I have opted for neurosurgery. By the way, I was given the scholarship by KPK government at that time for neurosurgery, being the best graduate. So what happened was that I took a challenge. Whenever you are not ready to take a challenge, opportunity will not knock on your door. Remember this, especially my young brothers and sisters. You take a challenge and it becomes an opportunity of a lifetime. And you do things that you never think of that you would be able to do. Well, if I didn't feel I would be anything apart from a little small doctor sitting in a village. But then neurosurgery really took me high. And then let me tell you, what did I learn from neurosurgery? By doing neurosurgery properly, I started learning Quran. I started reading Allama Iqbal. For any doctor, especially for a neurosurgeon or spinal surgeon or any surgeon, for example, you should be so sharp and so professional and so expert that one complaint, one question in a history, one examination, for example, what I mean is least, one examination or a physical examination and one test with least discomfort, least cost, and least time spent, you should be able to get to the diagnosis. By the way, in 1993, we had a conference of Pakistan Society of Neurosurgeons, first time in Islamabad. And there I defined neurosurgery as, you'd be surprised, at that time I was a young man. I defined it as, because I was studying Allama Iqbal, and I was very impressed from the eagle. I said, neurosurgeon is like an eagle. High flight, sharp sight, quick decision, prompt action. If you are able to do that, you will be able to relieve and you will be able the pain, and you will be able to save a life. You may not have much time when you have a cup of tea and you want to become a neurosurgeon. You'll say that, all right, there is an extradural hematoma, patient is like this, let me finish my cup of tea. No, the cup stays there and you run. And that's how you catch your fish like an eagle. There is something else I told you about Quran. Why did I say one thing at a time when you have to squeeze your time? The more you do it, less time will be spent. Less expenses. There is no way that you have to do 10 tests when one test can really solve the problem. And that depends on your proper history, proper examination, and knowing which one investigation is relevant. So that is the most important thing before you could come to an endoscopic, microscopic, or open surgery. So decision making is based on that. And because there were young people sitting here, I would say that Ihdina Sirat al-Mustaqim is in the first surah of Quran. Allah, oh God, give me the straight line between the two, or teach me the straight line. What is a straight line? If there is a point here and a point there, the shortest distance, the shortest time, the shortest cost, and the shortest and the least discomfort. This is Ihdina Sirat al-Mustaqim. So I learned Quran from neurosurgery, and I learned neurosurgery from Quran. You know, I have so many friends everywhere as neurosurgeons, all across Pakistan as well as abroad. At times, the respect, the recognition, and the attention that you get as a neurosurgeon, sometimes it takes you back for a minute and say, I don't know what did I do? I did just my job. I just did my job. But then, as I said, there is ilmul adyan. There is also the reward that you get, which is much higher than the material gain that you think you will have with neurosurgery. It's much more than the money. It's much more than the fame. It is much more than the recognition of the people. And this means that if that kind of situation comes, this means you have done your job. So, sorry, I have become too philosophical, but at the end, I would say it was pleasure, and thank you so much for inviting me. Jamal Nazar साहब, आप तो खैर हैं ही बहुत बड़े स्पीकर, लेकिन ये है कि जी चंद छोटी छोटी बातें थी which I wanted to share with you off the cuff. So I just went on. I'm sorry if I have taken too much of a time, but congratulations on organizing such a wonderful activity that is not easy to organize. To be honest, the credit goes to the management perhaps, and I think we all should clap for all the organizers, especially the younger girls that were here, the young boys and the girls, and I think the whole management, including and especially Nawaz and Farooq. I think last but not the least, it would not have been possible if our friends from abroad would have taken time and all the effort traveling from all over the world, and especially our friend from Britain. She is from Pakistan, but she's settled there, and she told me such a feedback from about England since I left. I think it was a pleasure meeting you all. I'm sorry if we did not really look after you so well because the weather, all the different activities that are going on. And at the same time, I apologize on behalf of the organizers that they really did not let you rest. You worked so hard. I know that they really took every bit of knowledge and wisdom from you. Thank you so much. Thank you. God bless.
सर मैंने बड़े अरसे बाद इतनी अच्छी तकरीर सुनी है।
अच्छा, अच्छा, अच्छा।
मैं आपको